everything,
capture the screen.
and then I can share it with you. And yeah. Okay, so this is your today's schedule, and of course yesterday, I'm sure it was like first day very hectic. But today's hopefully better. Plus, Old Bridge stuff is new to this, but East Brunswick stuff is very familiar.
Yeah.
All right. So, well, first of all, what I suggested to them, because this is the way they set up, so they would make it more clear the visit types, because there's so many new visit types now. So they will just make 4 visit types, indicating new patient, diabetes, and follow-up. But they will take care of that.
So that's going to be uniform.
Yeah,
right?
yeah, they will take care of
So
that.
4 visit types. All right.
Yeah. Now, I noticed that. So you stopped locking the notes, right? So you just mark it down. Yeah. The idea is this: if the note is locked, it means that it can be unlocked if needed. But so what happens when billers they do billing, they go through the note. If they see something that's not clear, they may send you a message and say, "Can you please clarify this in your note?" And you can change. You can say, "Well, if it's not locked, you can add something," or if they ask you to do this. So, and then once billing is done, usually they're going to do it like for the whole month, for the month back. Like for example, right now, they just recently did billing for October. And once they do billing, so they will send you a message that you can lock all your notes, let's say for the month of January. And you can do it with one click, you can lock all your notes.
Okay. So it won't be a problem as far as signing, because in our old EMS, every time you write a note, it's signed, and it gives a timestamp and everything.
No, timestamp is given when you lock it.
Okay.
So that's why what you do is you mark it as done.
Yeah.
Done means that for billing, this is a sign that you're done with the note.
Okay.
You're not going to change it unless you have a reason to change it, and they can just do billing.
Okay.
Right. But they need this because sometimes.
So this is fine. So
this is fine, right? This and from yesterday, so they were locked. But you can, if they need you to unlock them, they will let you know, and you'll unlock it if needed. But it may be fine. So that's good. So now let's just go through each of them, and just to make sure that we're on the same page and things are done properly. Okay. So, for example, like this patient, right? This is a new patient. So in your chief complaint is, you can just put anything for chief complaint. So what I do, and again, this is like not, I just put usually the chief complaint, like you can put Hashimoto's or you can put like new patient. There's already pre-printed things like that. For example, if you click on chief complaint, like here keywords, for example, if I say new, so it comes like new patient or new to practice, something like that, which you can use, or you don't have to, or you can just use.
I can put both of those.
Well, yeah, this I'll delete that, right? But Hashimoto is fine. Chief complaint is not something that's really needed. Of course, you can put it in, like HPI. So in HPI, and again, that may be different how you did it before. That was part of the hospital work. So basically, you're referring here to those documents, right? But and again, whenever we do things, we always think in terms of, okay, if we get audited, right? So what the auditor will see, what is matching to the coding. So, well, the auditor will not go to scan documents and read it. So, the history is needed in your HPI.
Okay.
Yeah. So whatever the history was, So that's not sufficient just to say like this.
Okay.
Now, do you just type it?
Yeah. So I had dictation over on the other side, so I have to type here, so I don't have a lot of time to type it in, but I can add more stuff later. Now, I understand that there's a way to get dictation, right? So
two ways.
Yeah, so I called them and I messaged, and it's just a mess. I have at Old Bridge, I got Dragon, so I was dictating the notes, but here I don't, so that's why I can't. I just don't have a lot of time to sit there typing.
Okay, so ask now the way we figure out with the clinical. So if you put a request through their support side, so they start bombarding you with the phone calls and everything. So whenever I put a request, I put it replied by email, don't call. On the other hand, if you need something real like this, they tend to procrastinate and things like that. So we should really push them. So ask whenever, if you feel that they're not getting back to you right away, ask Dr. Schaefer Joe just to expedite that. So you can text him, you can email him, because he is basically a coordinator.
I'm getting different messages from everybody about this. So I got Dragon working at the other side, and I can dictate at Old Bridge, so that's
Right.
working.
Mhm.
But when I messaged with eClinical Works, they said you could only do this with Dragon. Dragon has to be installed. And I talked to Schaefer, and he said you don't need Dragon. You can use this. But then, like, I'm over here and I can't dictate,
Right.
so I don't have Dragon.
So what you need to do is you have a smartphone, right?
Yeah.
So you just have to have them install it on your phone, and this is like I told you, this is like unbelievably 1,000 times better than Dragon.
Okay.
It makes no mistakes. I can show you how I do this.
Is it? Do they have something on the back end?
You don't have it installed, right?
No.
Like this,
Okay.
eClinical.
eClinical. No.
No, where you can look up your schedule. You can send prescriptions. You can do anything. So you should have it done. You should have it installed,
Okay.
and so basically you just do everything. And
Do I get it from the App Store or?
yeah, but I don't know if you can just do it yourself or they need help. But try to do this. What we can do actually, just so that you have it done as soon as possible, we can finish like maybe at 1 o'clock, and then you can maybe have Dr. Schaefer help you to do this
Okay.
because he's here, should be here. So this way, you don't even need to. It's like, I told you, it's even if I stumble,
Uh-huh.
it recognizes it,
Okay.
and it just does it does like pure recording, and then it automatically syncs there. So that's the best way to do it here, like through this. So I click on each patient and I do it.
Okay.
Now there's another way of doing it through here. There's but it's not as good. Like for example, let me just pull test patient. Okay. So whenever you see a microphone sign,
Uh-huh.
it means that you can dictate. But it is not as good as the one in the phone. The one in the phone is like 99.9% accurate.
Okay.
So it except that if there's some, let's say, new medications that are not in the system,
Uh-huh.
it will mess it up. But you can record those medications once, the way you pronounce them, and they will stay in the database.
Does it go when you record here? Does it go into?
I'll show you. I'll show you. Now this one is not like 100%. Let me just show you how to do this. Patient presents for a follow-up of his multinodular goiter. Wait a second. Hello? No, it's not. Okay, yeah. New paragraph. So it's not. Let me just clear it. I can click here and just do it again. Patient presents for a follow-up of diabetes period. His sugar is inadequately controlled period. His last A1C was 7.6%. Okay, so it's like it messed up here, right? But otherwise it was, yeah. So now, and then I'll just close it. Okay, so it's here, right?
Okay.
But I don't use this because I use one on the phone. Let me just show you. I cannot do, actually I can do test patient. Then I have to have an appointment. Let me see if I can do test patient. Actually, I think we can do your test patient because that patient had an appointment. You can see this is your schedule for today.
Mm.
So you can dictate, you can call, you can record a telephone encounter, you can send prescriptions, refills, you can check labs, you can do everything here.
Mm.
So there was yesterday was there was a test patient on your schedule. Here, okay, right?
Mm-hmm.
Okay, let's do it. So what you have to do is, so here, and again, that's not self-intuitive, so you have to click here, and then you have to click on HPI, because you can dictate only into HPI. If it's you can dictate into other sections as well, but it's kind of like difficult to do.
Okay.
Alright, so let me just show you how to do this. And then you have to click here. Patient presents for a follow-up of diabetes period. His diabetes is inadequately controlled period. His A1C is 7.6% period. Patient is taking glipizide XL 10 mg QD, Actos 30 mg QD, and metformin 1000 mg BID period. Patient experiences hypoglycemia several times a day, primarily during the night period. He does not exercise period. New paragraph period, new paragraph. Diabetic complications have been discussed with the patient in details period. He had recent eye examination, which showed proliferative retinopathy period.
Oh, pretty good.
I think it's 100% accuracy. So now, click here, then I click scribe it, and now it's there.
We'll go on to the
Okay, because it was already signed, that's
yeah.
why it did it as addendum. Okay, that's
all right,
why.
all right, so
Right? So now if you go
so
to...
it'll just go in as an addendum.
If you go to... Oh, because it was signed, I see.
Yeah.
So now if you go to... You just... this is a calendar. So you go here, yesterday. And, this is facility, so you can just put all. So you see all the facilities on one screen, and you have to click refresh. Okay, you're right, because it was signed.
Okay.
That's why. Okay, let's see.
All right.
Now it's an
Oh,
addendum.
there's an addendum.
Now, if it wasn't signed, it would be an HPI.
I see.
Yeah.
Okay.
So this is so much better
Okay.
because it's more accurate than this. They have different technology here. So this is what you need to do. So you
Okay.
just have to have it activated.
Okay. All right.
And you can use that as well, especially in other sections.
Okay.
Now here you have to remember, so now after this, so you can, if you do done, usually I keep it on my schedule, like let's say this is your day, right?
Mm-hmm.
This is your not list. Yeah, so this is yesterday, and you can change it to today list. Okay, so those are your today's patients. You have to pay attention to see, like let's say if you order labs,
Mm-hmm.
and if patient goes to have labs done the same day,
Mm-hmm.
they will put another appointment, lab appointment in the schedule. So you will see this patient like twice. You have to make sure that you click on your appointment,
Oh.
because otherwise it will say labs. Like for example, this patient will be here twice with your appointment and with labs.
Oh. Okay.
You have to make sure that you click, when you dictate, you click on the right one, because otherwise it will not go anywhere.
Huh. Okay. How do you tell? So.
It will show the appointment type. So this is like it says non-DM Sun,
Oh.
but let's say if they do labs today, it will say labs.
Okay. But when it pulls up the schedule and you put provider, that should all be my patients, right? So that, okay.
Okay, let's see. Okay, so see, you have providers
Yeah.
and you have resources.
Yeah.
So those are your patients. Now, if you
Okay.
click on resources, so for East Brunswick, it's lab 2. You have to click refresh.
Okay.
Okay, so those labs are scheduled today
Oh.
in East Brunswick.
Okay.
So if one of the patients who you saw today, if you ordered labs to be done today,
Yeah.
they would put the patient here as well.
Okay.
So this patient would come up twice.
Okay.
One for your appointment and the other time is for labs.
Will it say? So
It will say here.
It will say. Okay.
It will say here. Like
So I just
lab.
gotta pay attention.
Yeah, just have to, because initially when I did it,
Okay.
it disappeared, and then I realized I clicked on the wrong
The wrong
thing.
The wrong.
Now you have
appointment.
to make sure when you do this, you click here.
Okay.
You cannot dictate here. You have to click here and then select HPI,
Oh, okay.
because if you do it the other way, it's not going to be dictated.
Okay. All right.
Yeah.
So it's the side panel.
Yeah. So this is about dictation. Let's just go back because there are important points to discuss here.
Sure,
Okay. And then you can see all, and then they're all like, labs, DEM, and you have
Okay.
the provider. Yeah, okay. Just provider. Okay, so those are your patients. So let's just look at today's patients. Okay. So yeah, so that should be like
sorry,
the
just
whole
flesh it out. Yeah, sure.
HbA, right? So medications the same thing. If she doesn't take any medications, usually we say like no medications, because they usually pay attention to all this. I mean, it's not crucial, but it's better if the sections are.
Or just dictate in that there's
You
no
don't need to dictate.
medications,
There are like so many things that can be set up that you don't need to dictate, because those are like, for example, if you click on current medications, you can either.
She's not on anything.
Yeah, so what I usually do, and what we're supposed to do, we get external history, we click here,
Okay.
and then you just go through, you ask the patient, okay, are you taking this? T, it means taking and not taking, and you mark T or N. Those are medications sent from, those are other providers.
Oh, okay.
This is from the pharmacy database.
Oh, okay.
You just ask, you tell the patient, well, at the front desk, they're supposed to get the patient consent
Oh.
for that, because patient has to give them the consent for you to get the information.
Okay.
But it automatically comes up.
And then if they're taking, you just hit T.
T or N. And again, if you do this, I don't want to do it now, but if you click T, it's not going to be click. You're not going to see it.
Oh.
But if you click, then it will show up here.
Okay. I
And
think she was. Okay, I'll go back and.
Yeah. All right. And now, if the patient got medications from, sometimes you don't see them here,
Yeah.
so it's inconsistent.
Okay.
But again, and obviously, if she was taking an antibiotic in April, you don't even need to ask about that,
Okay.
right? But something like chronic medications, yeah. So let me close this. Now, at the same time, you can play with this and see. So those are current medications here, right?
Mm.
So there's nothing because
We haven't
nothing was
anything
entered
in, yeah,
before,
sure.
right?
Okay.
Okay. Right. The same thing for allergies. Now let me show you some, but again, I don't want to mess it up here. I'll show it to you on the test patient, and then we can do it again. Okay. A review of systems. I guess that's fine. You can do something like that. On the other hand, there's a template which would list everything, and you can just change those. It will say like everything is negative, and you would just change those that are positive. I'll show it to you on the test patient.
Okay, sure.
And whatever templates we have, you can have them, and then you can modify them or you can use them.
Okay.
Yeah, so it's a lot easier. It's a lot quicker. Okay, so then and then you have you should have here, and that's in the templates also, like past medical histories here, like surgical history, hospitalizations. You just say like, I'll show you how I do this, and then you can come up with your own way. Okay, so this is, I guess you got the template for physical exam,
No,
right?
I used their.
Oh, use that. Okay.
I did it manually.
Okay. So now the ultrasound. Now, did you type it or dictate it?
I typed that.
Okay.
Can't dictate anything.
Okay. So what you can do, you can ask Matt tomorrow,
Oh.
because he built the ultrasound template in a clinical.
Oh, okay.
So you can ask him, he can show it to you, and he can copy it to you, so you can use his.
Okay.
I'm doing it in our old EMR because I like it better. I just go there, I do it there, and they're there. He does it in a clinical.
Yeah.
So whichever way you want. So maybe it's better just because you're starting with the clinical to do it like he does, so that there's a report.
Okay.
And you pretty much do the same thing, but it's very quick. I think he does it like this.
So So I'm documenting it here as part of the visit.
Mm-hmm.
Now, do you also document separately in a different?
Yeah, it's better to do it separately. So ask him how he does it.
Okay.
Ask him, or you can just look at his
Okay.
like appointments, but yeah, you can do it here as well. But the thing is, like, let's say the patient asks you, "Can I have a report?" Right, and so there's no report. But this way, it's easier because patient can just get the report. Many
Okay.
patients, they want the report.
Okay. And then, as far as billing for the ultrasound, how do you bill for the?
Well,
imaging?
you did it.
So
right?
that's fine.
That's
Okay,
fine.
right.
Yeah, that's fine. Okay, now, when you make an assessment, so with assessment, basically the way it works is you should put all the diagnoses that are part of your evaluation. So otherwise, if you have only one or two, this is not enough to support the visit code. Like, for example, like this patient has hypothyroidism,
Oh.
right? So you should also add hypothyroidism.
Oh,
primary
okay. So it's not
hypothyroidism.
enough that it's under Hashimoto.
Well, because it's just the number of diagnoses. Because let's say that if you discuss dyslipidemia, vitamin D deficiency, this and that, that's fine. But you have only two. So, when we are audited, we'll never audited, but if we are audited, they will say, well, you have only two assessment diagnoses. And,
Okay. So for the level 4, we just need Dr.
So it's better if it was discussed with the patient, you just mention it here. Now,
Okay.
and I'll show you how to do this quickly.
Okay.
Now, assessment, the best way is just in the assessment, just to have a list of diagnoses. And everything else, like here, you can put in the treatment.
Okay.
Like this phrase, whatever you put here, so it's better to put in the treatment.
I don't know how to do that because when I go to treatment, all it lets me do is put in.
Okay, so what you do, so you click on treatment.
No, it just has right here. I don't know how to enter free text.
Well, yeah, here.
Oh.
So you go to, for example, Hashimoto, you click
Okay.
here, and then you can do free text here.
Oh,
right?
okay, all right.
Now, see, there's notes and clinical notes.
Oh, okay.
Everything should be done here,
Okay.
not
all right.
here. Clinical notes means that those are your own notes,
Okay.
which would not be part of the medical
Okay,
record.
All right, all right.
And again, this is not obvious.
Okay.
Right? Now let me show you something else. So see, whenever there are 3 dots, it means that you can create templates for yourself. For example, if you click on 3 dots here,
Oh, the 3 dots is a template.
3 dots is not a template. 3 dots is you'll see. Okay, so when you click 3 dots, you get here. So those are a lot of pre-printed phrases. Some of them were done by us already. Some of them were there before.
Mm-hmm.
For example, and you can create your own. For example, somebody did like finger stick results. So if you click here, so you'll see the text here. I think that was Matt probably.
Oh, okay.
So now if you click OK, so that will be here,
Mm-hmm.
and you can clear them. So whenever 3 dots,
Some phrases.
now you can put new. So you put like your phrase. I suggest that you start with like some kind of a symbol so that it stays on top. For example, like this sign, and then you call it like whatever.
Okay. And then these will be private to me.
No,
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 it's
for
public.
everybody,
Oh, okay.
for everybody, yeah, and whatever, right?
Yeah.
So okay, so now it's here.
Oh, okay.
So now and you just name it so that it's clear what it is. For example, whatever you like. And if you click here next, so you'll see everything else. So those were part of the program. Okay. Yeah, and yeah. So let me just remove this one because we don't need that. Okay. And you can dictate here as well. So
Okay.
see, whenever there's a sign,
Sure.
again, it's unrelated to the phone one. I don't like it, but sometimes I do it. And you can fix it here if it doesn't come out right. Okay. So otherwise you can just type here.
Mm-hmm.
Okay.
So
and then
just put the discussion in the treatment section.
yeah. And from here, you can also do other things, right? So you can, what you should do, I think, is you should just get
That's
this
little,
one, little
note
thing
button.
here,
Okay.
the little thing here. You can just play with test patients and see how it is. And also, you can click on different things and see those are order sets. Order sets are the crucial part of the. I'll show you how they work. Order sets is like makes everything so efficient. And this is a clinic sense. I don't know. It's some kind of information. So basically, you can do it right, or you can send prescriptions from this, right?
Oh, okay.
So if you, let's say you want to send prescriptions under this diagnosis, so you just click here, kind of select it, although it's not highlighted, but and then you go to prescriptions, and then you can add, so there are some favorites, so those are like my favorites,
Uh-huh.
and I can select and I can change them, like whenever you see the star, if you click on the star, it becomes yellow, then you see your favorites.
Okay.
If you unclick it, you see everything, and then you can just type like Tyrus, and you start typing, and it's supposed to show up.
Okay.
And then you select it. There's the whole bunch of dosages. You select whatever, and then you can send it directly to the patient's pharmacy
Oh.
from here. You just have to make sure that it matches to the diagnosis.
Okay.
And then, and then there are labs. You can order labs from this. You can order labs here, and we'll talk about ordering labs. Now, the thing to remember, this is very important, and again, this is all recording, so you can listen to it. see the today's orders and future orders.
Mm-hmm.
There's a big difference. Today's orders, it means that this is a billable order. It means that the procedure is already done.
Oh.
For example, when you do thyroid ultrasound, it's done already.
Okay.
So you can put it in today's order.
Okay.
But if it's something that you don't know if it will be done, you put it under future order.
Okay.
Even for today, Matt does it differently because he told me that even if he orders labs, he already knows because it's a small office. He told the girls, okay, so please do labs. And he told me that I know the patient is having labs, so he puts them under today's orders.
Okay.
On the other hand, when I'm here and I order labs, patient goes there. I don't know, maybe patient will change their mind. That's why I put everything under future orders. And when medical assistant takes the patient, medical assistant moves the orders from future orders to today's orders.
Okay. So already done and going to be done.
Either done or you know this will be done today.
Okay.
Right. Now, how you do this?
It's really confusing because in the other screen where you order, it doesn't give this to you.
But I'll show it to you.
Yeah.
I'll show it to you. So, because the other screen may not be the right screen. Now, we'll talk about like how we order this, but those are labs, those are diagnostic imaging, and those are procedures.
Okay.
And also there are some favorites that you can click here. And again, those favorites are individual favorites, so you can set your own favorites.
Okay.
Also, when you look for the procedure, see it says starts with. You probably should change it to contains. Yeah.
Yeah, I was doing the starts with,
right.
And
Yeah.
I couldn't find anything.
Yeah. Okay. Now, you see right now today's order is selected, so whatever you order now will go under today.
Okay.
So if you want to go into future, you have to click here, and this way it will go under future.
Okay.
Okay. And if you did it by mistake, you can always delete it.
Uh-huh.
And to go there, you click on the arrow. It has to have a diagnosis, and it goes here.
Okay.
And we'll delete that.
Okay.
Okay, so that's how you can do this. Now, I'll just close this. Okay. So treatment. So you go Hashimoto's disease, start tyrosine.
Uh-huh.
Okay. And then you want to see patient in a year.
Uh-huh.
So, but if you
just bring it back sooner.
need to understand.
Sure.
So if, and again, I know in some clinics because they don't have time to see patients. So, but sometimes, especially in private practice, it comes to liability as well. If you kind of like tell the patient come back in a year, so you don't know what's going to happen with the patient. So
Okay.
it's okay if someone who is, let's say, you do ultrasound, they have small nodules, you want to repeat in a year, that's okay. And you don't do anything else, they can come back in a year.
Yeah.
People who we're treating with medications, so we should, especially, I assume she's been on it,
She's
right?
been on it,
Yeah.
yeah.
So she's
It's
been
just
on
a
it if she
refill.
does it.
Yeah.
Of course, I have people who say, well, I don't want to come back more than once a year. I've been on
Okay.
this dose for many years. That's fine.
Okay.
But most people, like, we do it like 6 months, 3
Okay.
months, whatever.
Fair enough.
Yeah, especially when it looks like start tyrosine, it means that somebody who's reading the note says, well, you're just starting it. You're not
Okay, I need
continue.
I need to edit some of this. Yeah.
Or you can say continue.
Okay.
Continue tyrosine.
I don't know how to. So that I wrote a new, and that's what it populated. In.
Correct.
Yeah.
Right. Yeah. So that's what I do now. There are
Yeah.
in general 2 different ways of documenting things.
Okay.
And we do it differently. Like I do it differently from like Marina Sherman. She's a nurse practitioner from Alexandria.
Yeah.
So I do everything in HPI, and you can read my notes. So I do, like, let's say dyslipidemia. Patient is taking this, denies any side effects, will increase atorvastatin to this, and I do it in HPI. And the reason I do it because I dictate into HPI. It's much easier for me to do it.
Oh.
Now, in the treatment, I have the template. I'll show you. I don't do anything in the treatment. It just says as per HPI.
Okay.
Now, most people do differently. So they put very little into HPI, but they put a lot here
Oh.
because they don't dictate and they say it's easier for them, which is okay.
Okay.
Which is okay. It's just kind of like different way of doing it as long as there's information there.
Okay.
Yeah, but I find it kind of like looks better when it's under HPI. So what I suggest to you, look at different people's notes,
Okay.
how we do it, and then you'll see how you want to do yours. So yeah, now right, so this is the ultrasound. Okay, next appointment 1 year. Okay, yeah, again, I would do it differently because you know you're treating the patient. Yeah, right. Okay, so that's that. Now let's go look at the next patient. This patient, right? Okay, this is a new patient, right?
Yeah, they're all new patients.
Yeah, okay. So chief complaint, again, you don't need to put chief complaint, it's optional, or you can put like new patient, whatever. Okay, so basically you're describing, you know, whatever happened. Okay. Okay. Same thing here, and I'll show you. That's okay, you can do it this way, like review of systems reviewed, or whatever, but once you start using templates, it will be easier for you to do it there, and it just looks better, the note looks better.
Okay.
Same thing here, current medications, medical history should be like marked here. And you can have medical assistant do it, or you can do it yourself. I like to do it myself, this way I don't need to verify what medical assistant does, unless, well, I let them do like social history, allergies, hospitalizations, because those things are not very important usually for what we're doing with the patient. But medications, I would review them myself. But again, it's up to you. I'm going to do this. Okay, now. Okay, so also when we evaluate the like let's say in this case the nodules, I would usually describe, because yeah, this is part of those are actually part of HPI, dysphagia, mass sensation, right? Because it's about thyroid evaluation. I would say what they complain of, what they deny, radiation exposure, family history. I would mention it in HPI because it's part of evaluation of thyroid. So this way HPI looks like bigger, and this information is relevant to the patient.
Yeah, I'll put more in there when I can dictate. It's just when you're typing.
Of course,
I can't type that fast.
Yeah. And the other thing is, like for example, I think Matt is I don't think he likes dictating it, but what he did, he created so many templates that he just does this. Clicks and it fills like very quickly. So once you see how that works, it'll be a lot easier. So same thing here. I would put, and again, that's okay. It just like what happens sometimes auditors, and again, we were not audited. They know, okay, it's supposed to be HPI assessment. Yeah. So I would just put it under treatment, like the same thing under treatment, right? Okay.
So assessment, just put the problem list.
I would put just the problem list. Okay, so here what I would put here, right? Non-toxic multinodular goiter I would put here, and you can have your own pre-made set of common diagnoses. I'll show it to you. It's very easy. Okay, so also in this case, just because you're talking about like what you can do is kind of to make it look better. So you're talking about thyroid nodules. So you can, it's not necessary, but you know, especially if you have only 2 diagnoses, so you can put a diagnosis of thyroid nodule as well, like multinodular goiter and thyroid nodule, because you're talking about nodules. Okay, so it's good thing is that you discussed other thing with the patient, like obesity, so that's fine. And there are a couple of diagnoses related to obesity, such as weight gain, if patient was gaining weight, something like this. Now, if you put it in the assessment, also it's better if you, I don't know if you discussed it with the patient, but if you did, then you can put it. I prefer, and again, I found it for many reasons, it works better, not to put it under review of systems, but to put it under HPI if it's something that I'm discussing with the patient. Review of systems I would put in, if patient marked it in the form, it's unrelated to something that we didn't discuss, like patient felt like dizzy or abdominal pain, but I'm not discussing it. I would make it as a review of systems. But if I'm discussing this, if it's related to endocrinology, metabolism, like obesity, I would put it under HPI. Okay. Now, the same thing here. So you have only 1 diagnosis here, but so that would be obesity, like would be here under treatment, right? Because if you click treatment, now what you can do is you can just simply copy and paste. So what you can do, like let's say if you want to fix your notes, so you can just go to assessment, So you just do like copy and paste it in there.
Oh, yeah.
Like if you want to do this.
Sure.
Or you can dictate here as well, if you want to see here.
Okay.
And something, let's say you find, okay, I'm going to be using it often. You can always go here, 3 dots, and you see this is different. This looks different from, the one that we looked at, because those 3 dots, they're different in different parts of the note.
Okay.
So this is different. So you don't see those. So you can just add some of the things here for you.
Okay.
Okay, now, you're not doing FNA today,
No,
right?
I've
But you see,
scheduled for
it
next
already came with the code. It means that
Yeah.
it will be built today,
Oh, okay.
right?
So how do I do that?
Yeah, don't worry
Okay,
about this,
alright.
because billers will know that they will have to verify. That's why they verify everything. But what you do, and I'll show you how you do it, and because of the time, just the other thing is, and again, this is like how we work, and it works better. So if I see a patient who comes to me,
Yeah.
like this patient, who had the thyroid ultrasound done in September, you would be amazed. And again, I don't know your experience in the place where you work. Even in the very reputable places, when they do thyroid ultrasound, sometimes it's just not what people have, because technicians may not be very good. So I always do it, even if patient had it done 2 weeks ago. I tell them, well, I have to be responsible. So don't. And they say, oh, am I going to be charged? I say, no, you will not be charged. We never charge patients for this. If we're not paid because ultrasound was done, we don't charge the patient for that. Right, and that would help you to also to get experience in doing it. But I would do thyroid ultrasound on every single patient who comes in with a thyroid
That's a
disease.
good point. Okay.
Yeah.
Well, I offered it to her. She didn't want the
Yeah.
repeat ultrasound.
So what I tell them, sometimes it depends on how you present it. I tell the patient, well, that's what it is, but I have to make sure. I said technicians are not as good as doctors. I briefly explained to the patient the process. Technician does the ultrasound. Images go to the doctor. Doctor has to put them together, especially with Hashimoto's. It's very difficult. And when I examine them, I don't recall a single person who would say, don't do this,
Okay.
because I have to be responsible for that.
Fair enough.
Now, what's going to happen?
Oh.
What if patient comes back for FNA and you don't see it? You see Hashimoto's gland. You're going to tell the patient, you don't have it. When the patient is lying on your, and you say, yeah. So that's why, especially for FNA, I would definitely do this. But and with Hashimoto's, I'm sure, we've seen that. Yeah.
Sometimes it happens.
Okay, so what I would do here. So you do. How do you put it here? Where do you go? Did you go here to procedure codes?
Or
treatment?
What I did is I did treatment.
Treatment. Okay.
And then,
By the way, you should never use this procedure here.
God, it's so confusing.
You should always go to treatment.
Okay.
Don't click here.
Okay.
Yeah, this is very confusing, and I was very surprised when I saw all that. But they said that's the way it is. Just have to remember, use treatment for everything.
Oh, okay.
Yeah, don't use any other sections.
So I go into treatment.
Yeah.
And then so there's no today and future in here. So like when you go to, so yeah, this is where I was ordering. So yeah.
See.
Oh, up here. Okay. All right.
Yeah.
So you gotta click through. But if you do, okay. So how come that first page doesn't have, like right here it doesn't? So I come over here.
Okay. So
that's the wrong place.
I see. Yeah.
Okay.
Yeah. You have to go here.
You have to put in. Okay.
Yeah.
So then you enter it into future. Okay.
Right. Yeah. But again, once you start doing order sets, you don't need to do any of that. I'll show it to you now. I'll just quickly go through the notes.
Okay. Order set.
Yeah, we need. You know what I would suggest, because this is an important exercise. Let's just do it like till you have to leave, and then I will tell Dr. Schaefer to. Actually, you should be able to do it yourself, like to call them, and they will just try to download it yourself. See if you can make it work. If not,
I'll go onto the website and see if they have a link.
No, I think you can just go to the App Store.
The App Store, okay.
Yeah, and App Store, it's called eClinical Mobile.
Okay, very good. I'll work on it later.
Yeah, I think you should be able to. I think the problem is, I think you need to have.
Oh, here it is, eClinical Mobile or eClinical.
Yeah, this one, eClinical Mobile. Yeah, this one. Yeah.
Right.
Yeah.
Okay.
Yeah, let's try to do it now as we're doing it, because I believe you need another login type for this. I'm not sure.
Right.
It's not.
Okay.
Yeah, it may not be that straightforward.
I'll
Okay, let's look at the next note. Okay, this patient. Okay. Again, you can do it. It's just, you don't need to do this, but you can do it. Is it?
Yeah, it's installing. Yeah.
Oh, it is installed. Okay. Now, okay. So, yeah, the same thing. So this should be like filled, right?
Okay. All right. I'm filling it more.
Okay, so that's that. Okay, so assessment. Okay, so what I would do, and again, you have 3 diagnoses. I would just say subclinical hyper. Actually, it's hyper, right? It's not hypo. So here it said hyper. It's probably type of hyperthyroidism.
Yeah, it should be.
Yeah.
Subclinical hyper. Yeah.
Yeah, and she most likely,
Change that.
has thyroiditis, right?
Yeah.
Because her uptake is very low. So, you can put in, for example, abnormal thyroid function test. There's a diagnosis, and I'll show you how to build this.
Okay.
And or thyroiditis, subacute thyroiditis, something like that. So you can add more relevant diagnoses, which are relevant to her case. So it looks nicer. You can. Yeah. Okay. Now. Okay. So for here, you're ordering labs. Now, are you ordering labs for today or for the future?
She's coming back tomorrow morning to draw labs.
Right. So here, it's better. And again, in a small office, you can come out of the room and tell the girls. But it's better if notes indicate when you want the labs, because it's not clear. You would say labs today or tomorrow or in 3 months or before the next visit. So it's better to. And I'll show you how to say it.
Okay.
In a quick way. You can type it, of course, but there's a better way. See, now, they also came with diagnosis codes already, although they were not done.
Yeah, I don't know.
Yes, don't worry about it. So they're not going to be billed anyway, but just for the future. So
I think it might be that future thing.
Yeah.
And then, so for the inpatient labs, I don't need to send it, right? I just order it. And that's it. I don't need to. There's a send. Like when you go to the orders, there's a send button. Like you've done it, and then it says send.
Where is it? If you go to treatment.
Like when you're putting the orders in. So this right here. So I
I
don't need to do that.
Yeah.
So just because I think that's why it populated. So I won't do that.
I see.
Anymore.
No.
Yeah.
Okay.
So that's only for if they go to Quest or LabCorp, then I send it. Right.
Even if they go to Quest and LabCorp, I usually put it here, and the girls at the front would print it, so they can print it.
Okay.
So you don't ask them how they do, because each office may be doing it a little bit differently. Old Bridge, they just started doing it. So, but between here and East Brunswick, I don't know how. I think now, because you're going to be in Old Bridge for the most part, when they ask you certain things and you're not sure, just tell them to check with other offices how other offices doing it. Okay. It may be because we've been through this, so we had our pains.
Okay.
Yeah. So, yeah. Now, just in general. So if she is now, you want her back in August for thyroid ultrasound.
That's right.
What about her labs? So what's going to happen with her labs?
Well, she's going to get those now,
And
then depending on what I find, I'll probably get some repeat labs for next time.
Okay, so right. So in this case, okay, so you're just doing the labs, and then you're going to call her, or how are you going to do this?
Yeah. So when the results come to me, or I guess I'll mail it to her. And how do you usually?
Okay, so usually
they're not electronic, right? She's not electronic. Can you tell?
She's not. Well,
she's not,
it depends. It depends on what you do with the patient. Like for example, if I'm seeing someone who is let's say something like that, depending on the situation, someone who is it this patient who? No, that's the other patient who had problems with the scheduling. there are a couple of ways of doing it. We can, like, let's say we're talking about only labs, not about thyroid ultrasound. We can say, okay, so you have maybe some inflammation in the thyroid, so it may be normal, so let's do labs today. And I can tell her, well, if they're normal, so then you don't need to do anything. If they're abnormal, we'll let you know, and we'll, decide how to do this. So that's one way of doing it. So this way, I would put in my notes, labs today, we'll call the patient with the results.
Okay.
So when I get the results, I will either call myself, or I can send it to the patient if patient signed up. We have to be very careful, because we discovered that many patients, after they signed up, if they haven't registered, they're not going to get notification. And some people would call and say, I didn't get any phone calls, and at the same time they signed up, but they haven't gone through the final step. So we kind of not using it very much, unless patients already kind of like, unless we're sure that patient signed up and registered. So now, at least in the beginning, when we want to establish, the patient kind of database and report the patient, unless the patient, let's say, lives far or unwilling to come, I would tell the patient, well, let's do the labs today, let's check things, can you come back next week so we can discuss the results? If she says,
just bring her back,
yes, I can, no problem, I will bring her back to discuss the results, to explain things to her. If she says, well, I work in the city, can we do it over the phone? No problem. No problem.
Yeah, it's a different practice pattern.
Yeah.
Because I'm used to, we just don't have enough visits. It's really busy.
I know. In Robert O. Johnson endocrine practice, I see patients from there. They order like diabetics uncontrolled, so they order everything and they say come back next in a year, because they don't have time.
So but we have more visits, so I just bring them back.
Just bring them back. So we patient expect to get like comprehensive care, nurtured. So we like to do this. So that's how I would do this. Okay. Now, and we can talk about, just because for the sake of time, we'll talk about the lab. I'll show the like what we have, and then we can talk about that. Maybe I will record the voice now. Okay. So that's that. Just looked at the next patient. Right now, renal calculi. So, are you doing anything, or are you just advising the?
I was going to have her follow, because she already has a urologist, so I was just going to check the labs for calcium and ATH screening.
Yeah.
And then she'll follow with her urologist.
Right. Okay. Okay, so, and the last patient today is this one, right? Okay. So this is also a new patient. Diabetes.
So I put the labs in, I put the meds in manually. It just takes time.
Right, yeah, I also sometimes, if nothing comes up there, I put them manually, but usually it's quick. You can, so you click here. Well, if you go here, you see them all, right?
Oh, okay.
You see many of them, not all of them. Okay. Sometimes you may not see them.
You can import from there. So you just hit the T. And
right. Okay. Now, if you do here, like, you look for them here.
Yeah,
okay, yeah. And then you can also put notes here. For example, when someone is, let's say, taking half a tablet, you can put here, like taking half a tablet. Or if it's insulin, I would put here how many units they're taking.
Okay.
You can do it here if you want to. Yeah. And from here, actually, you can go to past medical history, and just do it from here. Okay. Now, so say diabetes, so primary, whatever. Okay. So now, so you have your medications. Okay. Now, so with diabetes, again, this is our kind of like the way we do it, and everybody here, nurse practitioners and med do it. So we, when it comes to diabetes, provide kind of comprehensive approach. So we discuss everything related to diabetes complications and comorbid like dyslipidemia, hypertension. So of course we can address only like hyperglycemia, but it's probably not the best way of doing it. So most people, even if they have primary doctors, they have cardiologists, they miss. As long as we know it's under control, but I would mention, for example, if patient says, my cardiologist takes care of my cholesterol, that's fine. I would say dyslipidemia, fairly controlled on atorvastatin patient, it is managed.
Okay, so just list all of the individual.
I would list it, I would make a brief, I'll show you how I do it. I would make a brief description denies any side effects, well controlled or not well controlled, and patient prefers cardiologist take care of that, or unless you take care of it. And the same thing with complications. So I would address complications. I would say peripheral vascular disease, cerebrovascular disease at least once, and after that they may stay. If you do your note from the old note, it will stay there. I used to do it in the old system. New from old. In this one, I prefer to dictate everything. I find that it's better. Matt does it different. The Matt copies it from the previous note. I do it this way. Either way works fine. So I would, as far as diabetes, especially new visit, right? So, I would do, especially if you have, and of course, first couple of days, not a problem, but if you have like 50 minutes, especially for a new patient, I would just I would address everything with the patient. Especially this patient has hypothyroidism as well. So, right, this is our thing. So it probably makes sense to address that as well. So here you have one diagnosis. In this type of a patient, I would probably have like 6 or 7 diagnoses related to his diabetes. Would be diabetes. If patient had hypoglycemia, I don't know if patient had hypoglycemia or not.
Well, it's hypertension.
Yeah, but again, so I would mention if patient doesn't have hypoglycemia, would often mention no hypoglycemia. If patient had hypoglycemia, I wouldn't put it as a diagnosis. Patient is overweight, like I would put like overweight. I would put dyslipidemia. I would put hypertension, right? Because that's something that you mentioned here anyway. So I would make it as diagnosis because we, according to standards of diabetes care, we would address that as well, and hypothyroidism as well. Okay, now, so again, the labs are today or next time?
It's for next time.
Yeah, so I would make it clear that this is not today because here it looks, but yeah, we already know why. I would say, and I'll show you how I do this. So see, you put next appointment. Now, do you mean to do labs before the next appointment? Yeah, so I would put it here then, so that when patient goes to be checked out, the front desk, they know they have to make an appointment for labs.
Oh, they need another appointment for labs.
Because otherwise, now, if you click here and encounters to see what did they do. So see, they did make an appointment.
Okay.
Yeah, so they kind of probably write you note, or maybe patient told them.
Okay.
But otherwise, they wouldn't know.
Okay, I see. So that should go under a reason, right? A reason, just say labs before.
Again, I'll show you how I do this. Again, maybe as far as Brunswick, just not to overwhelm them with a different system, I would just do it as Matt does it, because he's there all the time, and they probably used to like his way. As far as Oldbridge, this is like fresh, so you just tell them how you want it to be done. As far as here, I would do it the way I do it because there's so many things here, and once we start introcing kind of new approach, it's more room for error on their part.
Yeah, we'll try to keep it.
And I'll show you how I do this. Or you can just make it. Okay, so they made an appointment for labs, and then see you. So now, as far as we can briefly mention it now, and then I'll tell you like separately. So as far as lab ordering, so for a diabetic patient, I usually do, and Matt does it, and everybody else, comprehensive evaluations because we address like patient is on several medications for diabetes, patient is on simvastatin, so probably should check on liver function tests and CBC as well, right? Because what if we can miss so many things with sick patients, and we see it all the time. Like next time a patient comes back every 3 months, and all of a sudden I say, okay, the hemoglobin was 13, now it's 11 or 10. Things happen, patient does, and then we can be blamed. We can say, well, as an endocrinologist, we're supposed to know patient is on aspirin or something like that, or maybe CHF. So we would always include that. And again, you'll do it like the way you want it. I'll just show you how we do it and what you can do. Like microalbumin as well, that's part of the lipids. In her case, she has hypothyroidism, so check her thyroid as well. Vitamins, metformin can cause B12 deficiency. So our standard panels, I'll show you, and then you decide how you want to do this. Our standard diabetic panels, Matt has his own, I have my own, but they kind of like very close, because we usually prefer to do comprehensive for a variety of reasons. reasons, well, we have to protect ourselves all the time, and again, that may be different from like what you do when you work in the hospital system. So we have patients here who are very knowledgeable about this, and who may say, okay, you know, you gave me the new medicine, you know, what is my liver test? Did it affect my liver? And you may say, well, Jardiance, you know, is not associated with any liver problem, but patients will find that, you know, in 3% of cases it may, and then, so we had some issues with some patients, and you need only one bad patient who's going to cause problems. So rather to protect ourselves, we order, like, you know, things to, you know, things like that. Or they may say, how my kidneys are doing, so, you know, we didn't check microalbumin, things like that. Right, so here ideally should be many diagnoses because they are all relevant. Hypothyroidism. I would check as far as thyroid ultrasound. Again, like I said, I mentioned, this is kind of like very easy for us to do. Patients' hypothyroidism. I don't necessarily would do it the first visit if I want to spend a lot of time. If I do it the first visit because, you know, I'm pretty quick and efficient. Of course, in the beginning, because, you know, new system. But I would consider it. I would just, you know, what if, you know, we missed something, and we were. Some people were burned by not doing it. You know. Yeah. So that's that. Now this patient, another thing. If someone is, let's see. So he's. Do we know his diabetic control?
Let's see. I think I wrote the A1C down here. Let's see. I put it down. Let's probably put it down here.
Yeah, 10%, right. So someone who's 10.7, I'm starting on the new medicine again. If we didn't have time, I would say, well, come back in 3 months. So now, if you have available slots and you're starting the new medicine 10.7, like I would say, well, you know, just let's see how you're doing. Come back like in a couple of weeks, 2-3 weeks. Let's just with your sugar. Let's see how you do. I would do this, just because.
Sure. That makes sense.
Now the other thing is, like with time, once you get your patients, we have 2 nurse practitioners. One here, she works full time, and she does most of my diabetics. And Marina Sherman is in Brunswick. She doesn't have too much time. She's looking to cut her hours in East Brunswick, like as you're there now. So you may see some of patients from her because she works in Brooklyn. But when you're here, so you can take advantage of her. She is unbelievably good, Alexandra. So something like this, like when you see a new patient and you say, well, we work as a team, we have a dietitian, diabetes educator, we have a diabetic nurse practitioner. Let's see how you do with the new medicine. I would like you to see nurse practitioner so she can assess how you do. That would help you to actually focus on new patients. And you can see this patient, let's say in 3 months, but in the meantime, you can either do it yourself or you can even work with her, with Alexandra. She's really good. She knows a lot of things. So you utilize her. You don't have it in East Brunswick and Oldbridge, but they may, if patients can come here, it'd be good. Marina Sherman can see them as well. But if you have room, then I mean, if you don't have room to see them, that's maybe you will utilize them. If you do have room, you can see them yourself, especially in the beginning.
Yeah, sure.
So that's that. So let's look at yesterday's patients quickly. Okay, so we'll go with yesterday. Okay, so first patient. Yeah, this is locked. That's okay. All right. So you give a brief history. Okay. Now, okay. I know because this patient is self-pay.
Okay.
So ideally, you should kind of be aware of their insurance as far as if patient, like let's say self-pay who does not have any insurance, it means the patient will have to pay for labs. This is different than self-pay patient whose insurance we don't accept, but patient has insurance. So patient can go to like Quest or LabCorp and that his labs will be covered. Patient won't have to pay for labs.
Okay.
So depending on this.
So let's see. Oh, it's right here. Okay.
Yeah, it says, so it looks like no insurance because but we don't know, because what happens if patient came in first time, maybe patient has insurance, maybe they just didn't record them. So I would ask the patient, how do you have insurance or not?
Okay.
The patient says, no, I don't. I would tell, okay, so we'll just make sure that we will order like the absolute minimum, so you don't have to be charged for that. And we can actually offer, if patient has no insurance, if patient has to pay to Quest, so it's better to do it with us, because our fees for self-pay patients, they're a lot less than Quest.
Okay.
And we can, even if someone already paid full price for the visit, we can say, don't worry, we'll include like brief lab work, so you don't, we won't charge you. In this case, you would send a message to the biller, just don't charge the patient for labs.
Oh.
But only if you see that, well, this patient is kind of like, cannot afford, then yeah. But if patient has insurance, which we don't accept, send out.
Okay.
So now, again, you're seeing him in a year. Of course, this patient is kind of like not taking any medications, just check up.
Yeah.
That's fine. Stable, especially self-pay, so, we don't want to take advantage of this. That's fine. Let's look at the next one. So next one is Medicare. Yeah, basically here it would tell you what insurance patient has. Right, so that's Medicare. Okay. This patient, Graves' disease, first visit, saw Spiller, try to wean off MMIs. Okay. So he's taking the medicines again. So again, this is like our approach, and again, you may use different approach. Whatever is irrelevant to what we as endocrinologists do, I at least bring it up to the patient and ask him if, for example, a patient's taking atorvastatin, cholesterol, so we deal with that as well. So I can kind of oversee it, and if patient says, well, my doctor takes care of that, don't worry about it, I will say, that's fine. But if we do labs here anyway, I would say, sometimes I tell patient, when are you seeing your primary doctor? Patient says, well, I see him next month. And so I tell the patient, we can do all the blood work here, so you can use this for your primary doctor. Or patient says, well, I'm going to have my physical like next month. I'll say, we can do everything here for you, and we can send it to primary, we can send it to you, and that can be done through the portal as well, if patient is aware of that. So that helps us, that helps the patient as well. And patient appreciate that, they don't need to go to the lab. Okay, now, this is just simply clinical thing, so I just want to kind of say how you do this. So if this patient, I assume, tried to wean off a couple times and resumes, do you know why? Is this because...
I think he just, the labs go up again, so he's not been successful, but I'm going to check to see how he does on the lower dose.
Right. Yeah. I would, in general, I would check antibodies first, probably, because if antibodies are high, so then there's like probably not a good chance that
unable to wean.
So, yeah, but again, that's fine. But if you tried several times, I probably wouldn't even do it. But that's okay. I mean, that's fine. There's nothing wrong with that. I would just check antibodies. So now, again, I don't know whether you meant to check it today or in 6 or later.
So I don't know.
Yeah, it says here 6 weeks. Yeah, but what about what was his current TFT? When was it done?
Let me see if I wrote it down here. A lot of it was in the previous chart because we're using two different systems.
Like what I would do, again, just from the standpoint of someone who will be reading this note, I would say patient's last thyroid function tests were done 2 months ago, so they were normal. So basically that tells you, that whoever reads the chart, okay, so they were normal, so you're not checking them right now, and you're decreasing it. But what if they were done like 4 or 5 months ago? So maybe it's better to check them first now, and then, because some people are really crazy, and then they will make you liable for this. They will say, oh, why did, for example, you decrease it, so it goes, TSH goes down, she starts getting palpitation, then she will tell, why did you do this?
I try to document some more.
There's documentation. And if it was done like 3 months ago, I would check it today's baseline, and then
I think I looked at it and it was okay, and that's why I ordered it. Let's see. It was a lot of new stuff.
Yeah, of course. Don't worry. This is kind of like the general. You will have some 15 minutes, right? General things, but
Sure.
yeah. Okay, now the same thing here. So methimazole, I would check liver function tests as well, right?
Okay.
And in general, like in this patient, 6-7-year-old, I would tell her, okay, so we're doing the blood test today. We can also check for other things if you're taking the medicines just to make sure you can use that. And patient says, yeah, sure, like why not? So we can talk how practice operates as well, and you know, separately, because of the time those are important things, so I can record the voice note. But if we can offer service to the patient, so that will benefit the patients, it benefits us, it benefits you, it benefits everybody. So that's something that you want to consider.
I'll try to pay attention to that.
So that's that. I'll just quickly run through them and then I'll show you order sets.
Okay.
So next patient. Okay, it does it sometimes.
Yeah, I see that. Yeah.
Right now, do you know function F5? Okay, so if you do something and it's frozen or you cannot easily do things, you have to reset it. So what you do is you press function and then F5.
Function F5.
And then it does this.
Oh, okay.
Yeah, it's kind of resets it.
Oh, okay.
Okay. Yeah, see, like here, a patient having lows, so this is hypoglycemia, so you can use it as a one of the diagnoses, hypoglycemia. So the same thing here, diabetes, so we would address complications, all comorbid conditions, everything. And like here, the same thing is, instead of one diagnosis, we probably would have several diagnoses.
Sure.
Yeah, you're starting patient on metformin, so yeah, and of course you can see him in 3 months, but especially if you're starting the medicine, you have availability.
Sure.
I don't know if you have availability. It depends. You may not have any availability. I don't know. Well, in this office, you definitely have an availability. Is Brunswick? I don't know. Oldbridge? I don't know. Probably not, because
I think they're a little busier.
yeah. So again, if it's here, you can, or you can tell. I think it would be a good idea if everybody, all patients know that you work out of their offices. So some patients may tell you, oh, it's actually better for me to see you here because, because some patients who, like, they don't know that we have 3 offices. So I would tell them, well, you can see me there, you can see me here. And it may be better to see them here because there's more room here for you than unless they, it's far. And of course, elderly patients who used to come to the office for a long time, they may not be willing to do this, but new patients who don't care, especially younger patients.
Maybe that's what happened is they filled the other 2 offices because they didn't know that this was available.
I think the scheduling initially was done by individual offices. Now we have like centralized number that will be used for all patients, but yeah. Okay, so yeah, okay. Okay, so then we have this one, right? Okay, so weight gain and thyroid nodules. Okay, so here you have your templates for review of systems, right? So you got it from somewhere.
I don't know where that came from.
Yeah.
It popped in.
Yeah, you just probably click on something.
I probably clicked something in it
Right.
today. I don't know how I got that.
Okay, so so pre-diabetes. So we probably can add also like weight gain as a diagnosis, maybe metabolic syndrome as a diagnosis, something like this. By the way, I just last time I looked at this situation was a couple of years ago. I don't know if anything changed since then. So for pre-diabetes, I think, like based on all the UKPDS and there were a couple of other studies, so metformin works for overweight people like under 60 years old. If they're like, because she's thin, right? She's no, she's not. Why is?
Oh, I don't know.
This is wrong, right? BMI 20.
That's not correct.
This is not correct.
Wrong,
yeah.
I don't know why it came out with
this
that.
is weird. Oh, okay. Yeah, I looked here. Yeah, she's overweight. Yeah.
Yeah.
But I thought, like last time I looked at it was a couple of years ago, that 60 years old and above, so it wasn't shown to be effective metformin.
Okay.
I remember that. Yeah, when I look at it. But yeah, this is weird. This is weird. Why is this? This is wrong.
Yeah, I think for
Wha-
people who are
wha- wha-
obese, it's worth trying.
Wait a second. It's totally wrong. It says height 2 meters, and it's not 5'2". Yeah. This is this just pay attention. This is wrong. I don't know how it came up, but this is totally wrong.
I don't know how that
Yeah, you see, I think this BMI is correct for this,
that's the wrong
but
way.
not for this.
Oh, how did that happen?
Yeah, I don't know.
Why is it not?
Yeah.
It should be automatically
Yeah,
calculated.
right. Yeah. But it's for some reason maybe I don't know. But yeah, we want to just see if you notice this,
If I
we have
can
to bring
Figure that
attention.
out, yeah.
Okay. Yeah. Okay. Let's look at a couple others, and then I'll show you order sets, and then. I just saw something that I wanted to point. Yeah, here. So we'll get repeat labs. She goes to Quest. Now, did you mean to do labs today? I mean yesterday,
Yeah, I think so.
right? And what does this mean?
I
She
think it
goes
was
to Quest.
drawn and it's, she does it at Quest. She gets labs from Quest. So I think they're drawing it and sending it to
But
Quest.
why she does it in Quest?
I think that's just where she goes.
Right, but if they were drawn in the office.
Oh, okay.
Yeah, I think this is
Yeah.
like the confusion. So when patients are, I usually do blood test in Quest.
Yeah.
Right, so she used to go to Quest. Now,
Oh,
if we draw it, it's not because her insurance accepts Quest,
okay.
right? Because she has Medicare. So when they say people, they don't understand that. So they think they think, well, they can do labs only like in Quest or only LabCorp because the insurance pay for it. This is wrong.
Okay.
If we accept patient's insurance, it means that we can draw labs here. And sometimes we can explain to, that rarely happens, but patient says, oh, like you draw labs fine, but you know, my I go to Quest and I tell them, that's fine, we don't worry, so we do labs here. We have our like special endocrine lab, so you're not going to get charged. So it's the same if we take insurance, you know, we can do labs here.
Okay.
So they, you know, and especially she's Medicare, so you know, I hope they didn't send it to Quest. They didn't
Okay.
here, but yeah, sometimes they don't know, or even
Okay.
people with the private insurance, we tell them, if we accept insurance, it means that
Okay, so
We-
most
we
people
accept
we can
insurance
do
for
the
labs.
labs in house.
Yeah. people who are self-pay for us,
Mhm.
we can draw it here, we can send it out if we don't accept the insurance.
Okay.
But they should, medical assistants
Okay.
should
So we should
know.
always go to Medicare.
Yeah.
Okay.
Yeah.
All right.
Okay, let's look at the last patient and then I'll show you order sets. Okay, thyroid nodules. Yes?
Are you in a meeting?
Yes. 10 minutes.
What?
10 minutes.
Okay.
Okay. Like you see here, you ordered follow-up 6 months, lab 1 week before the next appointment. Oh, what's this?
Let me see. So this is a procedure code.
Patient with, what's it, DEXA? No,
Oh,
document.
osteoporosis code. That's a code for osteoporosis.
Yeah, but this is this is not a because this is a procedure code. This is weird because we've never. But what did you mean to
I
do?
wanted to put osteoporosis.
Yeah. So if you did you want to order DEXA here?
No.
But this is a procedure code.
Oh, this is you know what it was? Is there's an extra window that pops up.
Ah,
and they say, have you screened for?
Okay, this is screening.
Yeah,
I
so,
see.
So
Okay.
it's,
Yeah.
So
But you see-
it's screening for osteoporosis.
I see. Yeah. But I'm not even aware that there's like a billing code for that.
Yeah.
I don't know. But don't worry, because the billers will, you know, they will scrub it anyway. They will see what does not belong here. Okay, let me just show order sets quickly because you'll have to go in a few minutes. It's like 15 minutes, 20 minutes, and we'll have probably 15 minutes. Okay, so order sets. The concept of order sets is so you can, instead of ordering labs, ordering ultrasound, ordering follow-up, different things, you can have all in one screen.
Yeah.
Let me just show you on the test patient how I do that. Okay. So I'm done with the patient, right?
Mm-hmm.
So I want to order different things.
Mm-hmm.
I want to do biopsy, FNA, I want to do labs, I want to schedule balance test, I want to do DEXA scan. Okay. So, well, first of all, yeah, okay. So I have my order sets here. It says order sets.
Mm-hmm.
So I go to my order sets, and those are my order sets. My order sets.
When I go here, I don't have anything, and then I try to search and I can't find.
Right, because you don't have them,
Okay.
but I can put them for you.
Ah, okay. Right.
Like I can put them later. Like when we leave, I'll put them for you. So those are mine.
Right.
You can use mine, or you can copy mine and make your own. And maybe tomorrow, Matt can show you how. I can show you, but actually it's on the. Yeah, I can quickly show you how to do this, but let me just show you the order sets first. So I have several. I use this one, universal order sets for everything. Now those are order sets for just for outside labs, and I can put all of them into your profile, and you can just play with them and see. And I have like for osteoporosis low Z-score variation as well. But let me start with this. Okay, so what I do, well, first of all, before you do order sets, you have to put the problem list. Problem list, now let's say this is, I don't know how you do this, I'll show you quickly. So this is a new patient, right? And you want to put the assessment.
Okay.
I start with this, I go to problem list. I click on 3 dots. And this is my, okay, and I go to add ICD, okay? Now here, I have my favorites. If I click here, I have a list of my favorites.
Mm-hmm.
What's, oh, okay, yeah, it just got here by mistake. I don't know why it got here, abdominal actinomycosis. I don't know why.
So when I search in here, a lot of times the stuff that I'm looking for is not showing up.
Right, yeah. So some diagnoses for some reason are not showing up here. I don't know how to do this. You probably, because I have this situation a couple of times where you just didn't get to have them pull more diagnoses. But this is a question for support.
Okay.
Let me show you what I have. So I created my favorite diagnosis set.
Yeah.
So they go in the alphabetical order, and those are the ones that I frequently use. Like, for example, abnormal liver enzymes, abnormal thyroid function tests, B12 deficiency, right? So those are mine. And if I click here on this arrow, it goes further. Borderline diabetes, fatigue, those are common diagnoses. Elevated LDL, dizziness. So different types of hyperparathyroidism, whatever. And I do this, obesity, multinational goiter, diabetes, okay, vitamin D deficiency. Okay, now, let's say I saw the patient, okay, now, so what I do, I go at diagnosis, I click here. If it's something that I want to look for something new, I just type here. I don't need to click here. Like, for example, what were you looking for before that you couldn't find?
Type 2 diabetes without complications.
Okay, because this is DM. But if I put diabetes, okay, so you have plenty of things. So if you keep clicking on this arrow, so there are plenty of different diabetes types that you can, you see there are a lot. Yeah. And then let's say something that you like and you want to keep for yourself. So what you do is you select it, and then here you click here.
Okay.
And once you click here, it will be there.
Okay.
Next time you click on favorites, it will stay there. So that's how you can build your own list.
Okay.
Some of them have like the same code, but they have different names. For example, if you put okay, so you see, for example, twice, it comes twice, and it has like different, or like here E039, you have like different hypothyroidism, but it's the same code. So you can choose either, like I have twice. I have it as acquired, and I have it as this one or this one in my list. Okay, so what I do, I click add, I do here, and then I go, okay, so this patient has like let's say I know this patient has abnormal function, thyroid function test, like
Sure.
that patient I
Okay.
put here, then I click here on the arrow. Okay, patient had Graves' disease, borderline diabetes, and so maybe dyslipidemia or hypertension if the patient had hypertension, or hyperlipidemia. It was before. I have it like dyslipidemia and hyperlipidemia,
Okay.
and let's say like type 2 diabetes and vitamin D deficiency.
Okay.
So then I can quickly do this. You have to be sometimes careful, I don't know, with the mouth, probably with the mouse more difficult. I use this. Okay, so I click here. Okay, now. So now they're here, but they're not here. So in order to send them here to assessment, you have to click on arrows. If you click on this arrow, all of them will come over. But let's say today you're discussing only 3 diagnoses out of all, so then you click on individual arrows, and they, once you do this, they show up here. So you do this, they show up here.
Okay.
But if this is your first visit, so you discussed everything, so whatever is here, you just do this, you click this arrow, and everything is here.
Okay.
Now, so this is first step. Next step, you go to order sets. Okay. Now, universal order set. So those are diagnoses from, not from assessment, but from what was here. And I would select, I don't need to select everything, but I would just select several that would support what I'm ordering.
Okay.
Like let's say thyroid, dyslipidemia, like vitamin D deficiency, I'm going to order vitamin D level and thyroid, whatever. So click OK. Okay, now that's the order set. Let me just quickly go through this and then we'll go. Okay, so you see there are several tabs here. So this tab is labs, so those are different labs. So next step here is diagnostic imaging.
Okay.
So next step here is procedures.
Okay.
The next step is different types of follow-ups and different. Those are different things I want front desk to know.
Okay.
Or if you just scroll it, you'll see everything.
Okay.
Everything. This is just like easier to do. Okay. All right. So let's say I'm ordering. So the F means future. So all labs that I have, they're all Matt does it differently. Matt has a lot of order sets. He has like tons of order sets. He has order sets for today's labs, for future labs. I have like only one, and I'll show you why. Okay. So let's say I want to order labs to be done today. Okay. So, and this is a CV risk profile. You can later see what it is. Like for diabetics, usually I order CV risk profile, and 1 and 2. 1 is for Medicare, 2 is for non-Medicare. Let's say I order male, and let's say patient has hypothyroidism. I want to check antibodies, and patient has osteoporosis. I want to check PTH. Okay. Now, default duration is 3 months, which means that if I order this test before the next visit in 3 months, I would leave it like this. If I want to be done today, I would click here, and I would put 2 days, because there's no 1 day here, but it doesn't matter. It's just basically an indication for the girls that, well, it should be done today, although it says like in 2 days. Doesn't matter. I'll show you why. I just put 2 days here. Of course, you can manually change it, put 1 day, but it's not necessary. Or if you want the patient to have labs done in 6 weeks or 4 weeks, I would put here like 6 weeks. I would put 2 days. Okay, I would change it now. It says 2 days. I would put 2 days here. I would put 2 days here. It's not absolutely necessary, because the last line will say when you want labs to be done. It just may be confusing later on if it says 3 months from now, because the date will show like March. Okay. Now, after you did this, so you go here. Okay. Let's say you're doing thyroid ultrasound now. I would put it here because it's today. It's not F. Now, if you want to do thyroid ultrasound next time, just don't mark it here. So mark it only if you're doing it now, so that it goes to billing. Let's say you're ordering DEXA. So you put it here because it's future. DEXA Medicare, DEXA non-Medicare. Because the codes are different. So you put DEXA Medicare here. let's say you want to schedule, it says ultrasound thyroid, so you can put it here if you want to. I wouldn't even do this, but
Okay.
so let's say patient diabetic, you want to check for peripheral vascular disease, so you mark it here, carotid and peripheral vascular. Okay. So then you go to procedures. Let's say you reviewed CGM today.
Mm-hmm.
You put CGM review because you did it today.
Okay.
And you want to schedule balance test. Or no, let's say you want to schedule CGM 3 months from now.
Uh-huh.
I put CGM insert here.
Okay.
This is future order,
Future.
and you want to do the balance test.
Okay.
Now, you go here. This is how I do it. So here I have everything to indicate to the front desk what I want to be done. I want to do labs today, so I put here labs today.
Mhm.
I don't want to do balance test today. I want to do balance test next time. I don't want CGM today. So let's say I told the patient, we will call the patient with the lab results. I would select this instead of this. It says labs today, we'll call. Okay. So then let's say I tell the patient, okay, we'll do labs today, and let's repeat the blood work before you come back in 3 months. I'll put here labs in 3 months as well.
Mhm.
So then I can put here follow up a week after labs.
Okay.
Or instead of doing this, I can say follow up in 3 months, and here I have labs 1 to 2 weeks before.
Okay.
If I want them to do CGM as well, I can put labs and CGM 1 week before.
And then, can you sign that, and then I'm gonna head on out.
Oh yeah.
How do you make it happen now?
Okay,
Oh.
so now I do close. Oh no.
Okay.
I have to do order selected.
Order selected. Okay.
I have to wait a couple of seconds. Once I see this placed, I do close.
Right.
Now,
So now
So-
placed
if you go
Okay.
to them, this is what it shows at the end.
labs today. Oh, nice. Okay.
This is what they have to see, because they don't work off this screen. So
Uh-huh.
they work of different screens. So they work of this screen, resource schedule.
Oh,
This is resource schedule.
okay.
Now, how do they know? If they click here, let me just show you something. Let me go to your,
Okay.
this is you, right?
Oh,
This morning, okay. So if they click here, this is what they see. They go off this, they
Uh-huh.
work off this. So they will see 1 week.
okay.
So now everything will be here,
Uh-huh.
so they will know what to do. So that's all.
Okay.
So let's do this. So I will make under your profile. Oh no, I cannot do it. I can do it only if you with your logins. If I log in, if you give me your logins, I can log in and I can put all
Okay.
order sets under your login. So then you can play with them,
Okay.
and then and I'll record. Then I'm going to be going like driving long distance today. I will record the note for you, just explaining a few things,
Okay.
important things, right?
I'll give you my
Sure,
login.
sure.
and then I'll-
Yeah, and then I'll just put those order
Okay,
sets in.
order set,
And you can play with them, and I'll send you this recording.
okay.